It's Black History Month. Welcome to the Honoring Our Heritage, Protecting Our Future, and Celebrating Black History Month program. This is a community dialogue series, and we're just really happy to have all of you be a part of it as we talk about a really important subject, which is how we protect each other through COVID-19. My name is Milam, and I am Crime Prevention Manager with the City of Richmond, the Richmond Police Department. You also may know me from some of the work that I do in the community around COVID-19 public information. And I'm really honored to be a part of this discussion today. So just a little bit about this series. This series is a partnership between Contra Costa Health Services and the African American COVID-19 Work Group and several different community organizations. So Crime Prevention is participating and RPD. And the goal of this series really is to promote COVID prevention, safety, and a sense of collective responsibility and spiritual insights based on Kwanzaa principles like Ujima. So for those of you who don't know what Ujima is, it is our collective responsibility to protect each other from COVID-19. And we have a wonderful guest today, Ezra, who I'm going to have introduce himself and tell you a little bit more about him.
Thank you so much, Michelle. My name is Ezra Bristow, and I am a locally based artist and arts administrator. I work with our communities and youth through a number of organizations and initiatives, including as a production coordinator and program associate at East Bay Center for the Performing Arts based in downtown Richmond. It's an honor and a blessing to be invited to be part of this conversation. I work with a lot of our families and youth through our arts programs, and so it was really important to me to come and just share a little bit of what I've been doing to try to keep myself and my community safe.
Thank you, Ezra. And I know you do a lot of great work with young people and have done great work with Juneteenth. And so I'm just so happy to have you here. You know, our whole worlds have kind of been turned around by COVID-19. And so you were talking a little bit about the work you do with young people. So how has COVID-19 impacted you?
I would say personally, the hardest part about COVID-19 has been making the tough choice of staying home. I would say an unexpected benefit is that it reduced my commute. And so I've been fortunate enough to continue working with East Bay Center for the Performing Arts to provide programming for our youth. But it's been extremely difficult when I am a dance teacher and we are trying to connect with our youth and connect and get them in their bodies and learn about the history of African American and Afro-diasporic art forms without being physically in the room with them. And so that's been tough in terms of the experience, but it's been really rewarding to see the ways that we've evolved or adapted to still connect with each other. Personally, COVID has hit hard. It seems like the more time passes, the more loved ones I know that end up testing positive or in some way impacted, whether it's a matter of losing work or having to take care of a loved one that tested positive. And so it's been really tough at times, wearing on the mind, the body, and the spirit, even if you're not the person infected.
Those are all really good points. And, I also love dance. I know how hard it is to go through that and not be able to share some of those things together. We're thinking this month's focus right now is Ujima and really the collective work and responsibility that we all have to each other. So in thinking about this, how have you used Ujima to protect our community during the pandemic? And do you think you're going to use it to help carry us through the new year?
Absolutely. I've been very much invested in, and I think the part that I see lacking at times is open communication. With so much misinformation that our communities have been dealing with and just historic distrust, it's hard to have that conversation to be like, hey, like, I know you want to see the family, but it's just the numbers and the information just don't align with that. And so what I've been doing is we live in the Bay Area, it's expensive. So I have a roommate and I have loved ones and friends that we've been having a dialogue about how to create a quarantine pod and being very intentional and very explicit and asking some of the uncomfortable questions that sometimes we don't feel like we need to ask our loved ones because we trust them. But the issue is that, especially with information about new variant strains that are more contagious, even the ones that you trust. I had a loved one recently that spent no more than 20 minutes with one of their loved ones and then come to find out that they both tested positive. And so for us and for my loved ones, it's been really about reminding them like, hey, like I want to be able to see you at Thanksgiving. Like I know it's hard now when birthdays and celebrations are passing, but I want to make sure that I can see you when we get out of this and when we settle on a new normal, because I really don't think things are going to go back to the way they were.
Wow. I mean, I think that's a really powerful testimony and one that everybody can relate to. Everybody's having those dinner table conversations. The other thing that's come up around the dinner table and come up around conversations is, understanding there's a lot of different sources of information about COVID-19 and the vaccine. So I just want to know from your perspective, what sources of information do you trust?
I have been relying primarily on the CDC's website, I would have to say. At the beginning of everything, it was just a matter of looking at what were the numbers. And I felt that looking at the numbers itself could be traumatizing. It doesn't create a complete picture, whether you're looking at nationwide or looking at what's happening in the state. And so I really relied on what the CDC was reporting. And rather than pay attention to a particular news outlet, I tried to watch and read a range of perspectives on what was happening and people's responses to it. But I think the first source of truth for me has really been using the CDC's website, because to me it was like, that's the best we have. A lot of the information is incomplete, and really relying on like local organizations and the healthcare professionals that are in our community. It's like they're on the front line. So really talking to friends and families and loved ones that are actively seeing what's happening has been really enlightening, and definitely informed my helped inform my opinion around how to best take precautions and what to do eventually if and when the vaccine becomes available.
Yeah, and you hit on an important point is, when the vaccine becomes available, what informs your choice?
I think ultimately, and I did a fair amount of research looking into the vaccines themselves, because I believe that one of the biggest problems in our community with mistrust and misinformation is not knowing where to go to find the research. And so I tried to look on as many health websites, just a simple Google search, not necessarily, I'm no expert, I'm an artist. So medicine is not my field of choice. It's not the way that I engage with healing. And so trying to find as many places to talk about what's the difference between the Pfizer vaccine and the Moderna vaccine, and what's a PCR test versus a LAMP test. Like there's all these words and new vocabulary popping up. And so for me, what I've settled on is I believe that the pros of getting a vaccine outweigh the cons. And I am on the younger side, healthy, professional, and I'm not in close contact with any of my at-risk loved ones. And so I think that if any of those things were different, if I had a pre-existing condition or those that around me had a pre-existing condition, I think it would be twice, if not 3 or 4 or 5 times as important to get the vaccine.
Will you take the vaccine when it becomes available if you were offered the option?
Yeah, I would. I personally, I struggled with it for a little while. I did go back and forth where it's like, and for our communities, it's like the first thing I think about when the vulnerable communities are the first ones to get a vaccine. I think syphilis experiments. I think Tuskegee. I'm like, all right, what are the side effects, and are they actually giving what they say they are? And I just think that um, we're living in a different time, and this is a pandemic. This isn't something targeted to just our community. We are disproportionately affected, but everybody's feeling this. And so there's a vested interest in everyone getting out of this. So for me, that was when I went back and forth about the historic and the current and everything else. It's like, yeah, but even those that might not be for us have a vested interest in this being maintained or controlled, if not outright eradicated. So yeah.
Yeah, I think you brought up a lot of important points. And I just want to thank you, Ezra, for having this conversation. I think it's an important conversation for us to have, especially looking at the principle of Ujima, like our collective responsibility to protect each other from COVID. These are the conversations that everyone needs to be having with each other right now. So I really want to thank you for being on today. And I also want to thank everybody in the community who's watching. We want to hear from you. We want to hear your stories. Tell us, are you having these conversations? And you can even use a hashtag and share your stories online. So the hashtag is Flatten and Flourish, because we really want to hear from the community, particularly the African-American community, about how you're having these kinds of conversations. And if you want more information, like Ezra talked about, you can visit the Contra Costa County Health website. I think that will pop up there, and find out more information to help inform your decision and your choice. And I really thank everybody for participating in this. I think it's an important conversation for us to continue to have, to be continued. This is Michelle Milam signing off, and remember to wear your mask and show love from a distance.